Hi, Dr. Minkoff here, LifeWorks Wellness Center. I want to talk about autoimmunity now and autoimmune disease in children. You may not be aware of it, but we are in the middle of an epidemic of autoimmune disease across the board. It's not just children, but adults as well. It's probably the fastest rising category of disease right now compared to cancer, heart disease, strokes, all this other stuff. It's autoimmune disease. Now, what's happening with this and what happens in children? Autoimmune disease means that the immune system is making an error, but it's attacking the person themselves. It can attack any different organ in the body. If it's attacking muscles, people will have sore muscles. They'll ache all the time. Their muscles will be sore. If it's attacking joints, they may have joint pain or joint swelling or even joint damage. Okay? If it's attacking the myelin around their brain, they may have paralysis or weakness or funny sensations, or they can't think, or they can't sleep, or they're depressed. All of these could be signs of autoimmune disease. Thyroiditis is one of the most common causes or common diagnoses of autoimmune disease, called Hashimoto's thyroiditis. Hashimoto was a guy who discovered thyroiditis, and when they did biopsies, they see that the immune system is actually attacking the thyroid. This is very common in adults, and we're even seeing it in children. I just had a family that came in, 3 daughters, all with Hashimoto's thyroiditis, and it had affected their thyroid so much in 2 of them that they were actually hypothyroid, low thyroid. These were a 7 and a 9 and a 13-year-old, 2 of which I had to put on thyroid medication because their thyroid was being attacked by their immune system. Now, when we look at this, what do we find? Why is this going on now? Mostly it's going on because the food that most people are eating is damaged food. It's genetically modified, it's pesticided, it's preserved, and it's not good food. It comes into the intestine, it causes injury in the intestine, and it causes damage. Do you know that if you eat food that is genetically modified, it is manufactured that way or grown that way because insects will die when they eat that food. It's a way to prevent insects from killing plant crops. And you know what it does in the insect? It causes a leaky gut. What happens in us when we eat it? It causes a leaky gut. When you get a leaky gut, you're going to get autoimmune disease, or you could get autoimmune disease. Okay? I think this is the basis for this epidemic. Now, there's all kinds of other insults that are coming into the body. Vaccines now, there's 26 vaccines, I think, in the first year of life. These are foreign proteins. They come in. The immune system doesn't exactly understand what these are. They're all foreign chemicals. It makes reactions. Sometimes those reactions attack us. There's lots of toxins in the environment. Heavy metals, chemicals, pesticides, cosmetics, shampoos, stuff that's put on us and in us all the time. And these trigger our immune system. They make it overactive. They make it attack us. So these things are reversible conditions in most people. You know, you don't have to go live on an island and not touch or see anybody or have anything touch you. For most of it, if we can fix the gut, if we can fix the diet, if we can get the immune system to calm down. And we don't have to resort to powerful medicines that have their own set of problems. You know, prednisone and methotrexate and Enbrel and Humira. You've seen these advertised on TV, always with a trailer of, it could kill you this way, that way, this way, that way. Talk to your doctor if you have an infection, if you have TB, if you have cancer, because these things have a big downside. Doesn't mean that they should never be used. Sometimes in emergencies, maybe there's a reason. There's a reason for it, but as a long-term treatment, it's not the solution. It won't correct what's actually wrong, which is why we're here. It's like, why did you get this? You can be helped. We can make you better. These children that had the Hashimoto's thyroiditis, the most common thing with Hashimoto's is gluten and dairy. I got them on a diet where we took these off. We did food panels to find what else are they allergic to. We handled that. We found that their bodies had a lot of other chemicals, pesticides, and bad bacteria and parasites in their intestine. We handled that. And you know what? The marker that showed that they had Hashimoto's thyroiditis, the antibody levels that show that the attack is going on, over a period of about 9 months, they go down, they go down, they go down, they go down, they go into normal. And when they're into normal, you don't diagnose Hashimoto's thyroiditis anymore. Those antibodies are gone. the thyroid calms down. In many cases, the thyroid, if it wasn't working because it was under attack, will start to produce hormone again. And then if we had to give them thyroid hormone, we can wean off the amount of thyroid because they don't need it anymore, because their body's actually healed and got better. Okay? So these diseases are really conditions of toxicity in most bodies. And to some extent deficiencies. The body's missing things it needs. And if we can handle those two things, we can actually get the body restored to the way it's supposed to be. And then people don't need medications, and they feel well, and their energy comes back, and their pain goes away, and they can enjoy their life, which is why we're here. Okay? It's to help people get better naturally. And naturally means how God intended your body to work. And if we can approach that, we can get the body to work. So, if you're suffering, if you know someone who is, call us, because we understand this, we're really good at it, and we can help you.